When people with cancer need access to health care, that can sometimes mean long-distance travel for extended periods. And they might also need to make the trip with caregivers. Helping to meet that need is a place in Boston called the AstraZeneca Hope Lodge Center, provided by the American Cancer Society. To tell us about the lodge is the senior manager, Matthew Blom. Thank you for being with us, Matthew.
Thank you. Thank you for having me.
You recently had a milestone there, an anniversary. Tell us about that.
Yeah, we've been open for 10 years. So we opened in November of 2008. So we just had our 10th birthday party this past last month.
Well, you have people who come here for quite a long distance. Tell us the story about it. Why do they have to come here, and what goes on once they get to Boston?
Sure. Yeah. So to sort of explain Hope Lodge a little bit, to give you a brief summary, we're, as you mentioned, owned and operated by the American Cancer Society, and provide free lodging for cancer patients. You know, some of us in the Boston area take it for granted that we have some of the best hospitals in the world right in our back door. But you know, if you need to come from all over the world, all over the country for cancer treatment, you might need some place to stay for a while. And so we're able to house you free of charge while you're going through your treatment. Majority of the patients that we see are either going to either Dana-Farber or Mass General. The majority of those two hospitals.
And I'm picturing here, these are people who have something pretty serious, maybe a hopeful prognosis, but they're going to make a whole bunch of appointments, maybe outpatients over a period, could be weeks, right?
Yeah. So the average stay at the Boston Hope Lodge is 6 weeks. So, you know, a lot of people have appointments every day, daily radiation. You know, it could be radiation, chemotherapy, it could be immunotherapy, lots of different outpatient cancer treatments that you need long-term housing for. And, you know, housing in the greater Boston area is a huge issue. It's expensive for one thing, and Boston is such a great city that there are times during the year where there's a hotel shortage. There just isn't that many opportunities to stay.
Well, I'm picturing people on a tight budget, and if they had to do this in the market, I think maybe the cheapest alternative might be Airbnb someplace at the edge of town or a little outside the city.
Yeah.
But even that, I guess, is pretty expensive.
Mm-hmm. Yeah. Average stay. So we estimate that when you stay with us for about 6 weeks, that we save $7,000. You know, the average hotel cost in the city, you know, $300, give or take. And like you said, you know, Airbnb, but it's also, you know, Hope Lodge is really nice because you have the sense of community. This particular Hope Lodge has 40 suites, and so you have something in common with 39 other people right when you walk in the door. And that's really what makes it special. We hear from people who will stay at a hotel before coming to the Hope Lodge, and you might have an hour of treatment in a day, and then you spend 23 hours in your hotel room by yourself. And you just don't get that sense of community if you're alone in a hotel room.
Well, you're there at the lodge. What do you see as far as that sense of community?
Yeah, I mean, you know, it's obviously called the Hope Lodge, and we see that all the time. We see such a great sense of hope. You know, people are very comfortable there. You have people from, you know, every walk of life, different backgrounds, but they have, you know, something very unique in common. And so they're able to talk to each other. They're able to support each other. Everybody knows what each other is going through. And it really becomes nice for the caregivers as well, because, you know, being a caregiver for somebody with cancer is not easy. And so it becomes that informal support network for the caregivers. They're able to do puzzles together. They're able to cook meals together. They know what each other is going through as, you know, patient to patient and caregiver to caregiver. So it really creates a lot of bonds and a lot of lifelong friendships that exist at the lodge.
This is BNN News. We're talking with Matthew Blom from the Hope Lodge Center. Matthew, I know you talk about the human interest aspect of this community here, but what about the healthcare outcomes? Does this make a difference, you think?
Yeah, absolutely. You know, so, you know, access to care is such a big issue in healthcare. American Cancer Society does a lot for access to care. We have transportation, but Hope Lodge, we know that people are getting their treatment. We know that they're close to their hospitals. And as I was talking about, people look out for each other. And so if somebody is not, we provide shuttle service. So if somebody is not on the 9 a.m. shuttle and they're always on the 9 a.m. shuttle, the other guests are going to look for that person and wondering, you know, are they feeling okay? Why are they missing an appointment? So we know that staying at the Hope Lodge, they're going to have better outcomes because they're more likely to go to their treatment.
What you also do to make this work is try to engage some volunteers. What do they do exactly?
Yeah, so we have volunteers that do a lot of different things at the lodge. One of the most common things is to come in and prepare a meal. So we have full kitchen facilities that our guests use. They, you know, we don't have a cafeteria or anything like that, so they're all responsible for their own meals while they're there. As I mentioned, we have the full kitchen facilities, but we'll have volunteer groups that will come in and prepare dinner, prepare breakfast or lunch, but most popular is dinner. You know, it can be a church group, it can be a Rotary, but we have a lot of businesses that will come in and prepare a meal. At the end of the day, after you've gone through treatment, you know, the last thing you want to do is cook dinner for yourself. And so if we can have groups that come in and prepare meals, it's a really nice volunteer opportunity.
Well, I can imagine a lot of people contending with cancer who would be just overwhelmed by, even if it were just a financial burden. So lots of them would like a place like this, and their family members would. Is there some sort of eligibility that's involved?
Yeah, yep. So we work very closely with the hospitals. We work very closely with the social workers and the resource specialists at the hospitals, and we rely on them to refer a patient to us. So the criteria to stay at the Hope Lodge, the Boston Hope Lodge, is that you need to live more than 40 miles away from your treatment facility. You need to be in active treatment and have at least 3 appointments or 3 treatments in a given week. And then once you meet that criteria, it's first come, first served basis.
Should mention, Matthew, if people want some more information or if they want to help out as a volunteer, is there someplace they can find more details?
Yeah, yep. If you go to cancer.org and just do a search for Boston Hope Lodge, that's probably the easiest way.
Thank you very much for being with us.
Yeah, thank you.
Matthew Blom from the Hope Lodge Center.